Okay, Dr. Kevin Brenner, you are a board-certified plastic surgeon. Now, I understand that silicone implants are legal, but silicone injections are not, and particularly silicone injections that the cops say are a grade above caulking material.
Yes, Jane, you know, I think it's very important to make a distinction between solid silicone implants, silicone breast implants, and free silicone injections. Free silicone injections are very dangerous. Silicone breast implants that we put in for breast augmentation, for breast reconstruction and cosmetic breast augmentation are FDA-approved devices that have been tested and proven safe for years. Free silicone injections are a whole different game, and I think it's, you know, this gets lost in the details of the headlines very often. What this patient probably had injected was exactly what you said, which was nothing more than, you know, industrial-grade silicone. There's several issues that you really need to pay particular attention to. Is not only the type of silicone, but who's injecting it, where you are when it's being injected, and what the conditions or the sterility. But basically, doctor, you're saying that they shouldn't inject silicone. That if you want a bigger butt, and frankly, I do not want a bigger butt. I don't get that whole. No, seriously, I don't. I can understand breast implants. Well, but I can't understand. Many women do. Okay, but for the implants, don't go for the injections. Those injections are likely to be illegal, correct? Well, I'm not saying go for the implant necessarily. There are techniques like fat grafting, which are very safe and very effective for augmentation of the butt. But if you are choosing to have silicone implant, you really need to do your research, because silicone injections are potentially extraordinarily dangerous, and in this case, deadly. What happens is the silicone, when it gets injected, whether it's medical grade or not, if it's injected in too large of volumes and injected inappropriately, can enter the bloodstream and in this case travel to the lungs and cause an overwhelming inflammatory reaction, which interferes with your ability to breathe. Well, that was a great explanation. That's what happened in this case. Yeah, thank you, doctor. Now, here's my big issue. Stop looking for medical markdowns. Seriously, sales are fabulous. But discount plastic surgery? No, not a good idea. Okay, just last month, this woman, Waleska Castillo, was charged with running a boob and butt injection clinic inside her Bronx apartment. Cops say she imported silicone from South America and charged $1 grand for a round of shots. She allegedly used crazy glue to seal up the wounds. Now, what's shocking to me is that people don't seem to, these people doing these crazy injections, they're finding customers. Spencer Ehrenfeld, you're a board-certified trial attorney, a malpractice attorney. Why would anybody travel all the way from London to go to a hotel and get injections when you could take that plane fare and get first-class treatment, a real doctor, in London?
Well, I think the more important question that I'd like an answer to is what is happening in our world, in our society, that people are feeling this enormous compulsion to risk their entire life to have a bigger butt or bigger breast. And they're doing this in light of all the media that's out there of people dying one after another by these pump parties and these butchers and these folks that aren't even licensed doctors, yet they're traveling across the ocean to come to the United States and have illegal silicone.
Well, I got an answer for you.
This need to risk their lives?
I'll tell you why. It's Hollywood. Hollywood is setting a very dangerous precedent for women, and I'm going to point to the E! Show Bridal Plasty as Exhibit A. I'm entering that into evidence. Let's take a look. It's a game show where brides-to-be compete to win plastic surgeries before their big day, before getting married. And, of course, who can forget reality star Heidi Montag, who had 10 plastic surgeries in one day, and she was left with a whole new body and a lot of regret. Listen to this.
I don't want to do that to my body again. I don't want to get any more Botox or any more surgery or any more lip injections. I think that I'm fine the way that I am. Yes, I feel stuck with them now. I really do. I really, you know, sometimes I wish I could just go back to the original Heidi with nothing.
Howard Samuels, as a culture, and I talk about this in Addict Nation, we are bombarded every day with these images of these surgically enhanced women, and women are getting hooked on trying to be like this.
Well, you know, Jane, I live in Hollywood, so I see this all the time. I mean, it's never enough. It's never enough facial
That's
work.
addiction.
It's never enough breast work. It's an addiction. And that's what's so sad about this. I mean, these women end up looking horrific because they feel it's never enough. So the work has to be more spiritual and about what is really going on internally for us as a nation, that it's all about the outsides. That is what's so sad.
It really is. Lieutenant Evers, if you're still there, was this woman who did this, did she have any kind of license, or was she just some lady with a needle?
At this time, we're still investigating if she had any proper license to do this, but just by the pure fact that she had people travel from the UK to Philadelphia to stay in an airport hotel and to communicate people with or through the internet, I doubt very highly.
Could she be charged in this woman's death? Is it possible? Is it possible, yes or no? Could she be charged in this woman's death?
Well, right now it's a suspicious death. It's a death investigation. The district attorney's office in Philadelphia will sit down with the investigator, the ME's office. It's a
and you're going to make a decision. Thank you, Lieutenant. Got to leave her right there. Thank you, sir. Okay. Thank you, panel.